Okay, perfect. Welcome back to the Health Revival Show. We are so honored to have Dr. Jon Marashi. I said it correctly, a world renowned dentist. And we're so excited to chat with you today on the importance of dental hygiene and just how much our oral microbiome plays a big role in longevity. So, without further ado, I will not spoil this. I'll let you introduce yourself to our audience, let them know who you are, what you do, your zone of genius here, and then we'll dive in and I'm sure just have a fantastic conversation.
Good morning, and thank you for having me on. I'm excited to be here. My name is Dr. Jon Marashi, and I practice in Los Angeles, California. My career has garnered me the title as dentist to the stars, and I've had a pretty wild ride because I get to take care of some really fun and amazing, successful and notable individuals on a daily basis. And the reason why folks are coming to me, first and foremost, they want to have healthy teeth and gums. They want to have a beautiful smile. They want to keep their teeth for the rest of their life. And how this ties in today is that there is an increased awareness around health and longevity. And so the two directly tie together. So we're going to have a fun conversation today.
Yes. So let's start off with maybe just a fun myth. We see so many things on the interweb, social media, TikTok trends, all these things, right? So I'd love to hear your thoughts on oil pulling. Is it important? Is it myth or bust? Or whatever we could say. Is it good or not? And then also same with tongue scraping while we're at it, just because I think those two kind of go hand in hand.
All right, let's start with oil pulling. Legit or fiction. I would say tie goes to the winner on this one. So I have a lot of patients that do oil pulling and swear by it, and they have really clean mouths to begin with. And I have some of the laziest hygiene patients you've ever seen that also have really clean mouths as well. We don't have any long-term data studies that are controlled to show people with and without clean mouths and with and without certain predisposing risk factors to say, if you do this, the improvement you will get is X. We don't have quantification on it. What I can tell you empirically, meaning like I'm a guy who goes in day after day and gets to hear what people, are coming back to me with and what my dental hygienists get to see is that number one, there seems to be an improvement. And number two, and this is probably important for your listeners, there's zero downside associated with it. So I'll get people asking me about, trends and fads all the time. And, some of the things you want to think about are, okay, what's the worst thing that can happen? Because if nothing happens, all right, knock yourself out. But if something bad is going to happen, then I got to steer the person clear of that. I could tie that into something else, like alkaline water is a big one, right? And there's a lot of benefits for it. And we have data on that. But when an individual comes in and says, hey, guess what? I don't have soda anymore and I'm doing the alkaline water and I put a lemon in it. And I'm just like facepalm because now what you've done is you've gotten rid of the alkaline factor of it by putting something acidic in it. And now it doesn't even work. So yeah, that's, oops, there I went. I'm back.
There you go.
Yeah, so that's that's a funny one that I get to hear. Now, you asked me about what was the other one you asked me about?
Tongue scraping.
Tongue scraping. Oh my God, mega fan of tongue scraping. And I like using a copper tongue scraper. There's some really good ones out on the market. Okay, let me tell you why. So I'm sipping down on a cup of coffee right now. And by the time I'm done, if I stick my tongue out, and I'm not going to do that to you guys to gross you out, it's going to have a brown layer on the top of it. And, jokingly, I like to call it Starbucks tongue because over enough time, coffee will leave deposits in between the taste buds on your teeth. And that film layer that's in there serves as a food source for bacteria in your mouth. And they're like, sweet, let's party. Now we can grow and we can multiply and proliferate. Well, the problem is that the byproduct that these bacteria, when they consume what's on your tongue and they spit out a byproduct, it stinks and it's not healthy. And they call it like, you have to forgive my oral med right now. It's sulfur releasing compounds or something like that. And I'm going to have to Google it just a second. But the point is that you're providing them a breeding ground and you have disrupted the oral biome that's associated with it. So tongue scraping does an incredibly effective job because it is a mechanical action. It's like raking the leaves on your yard, but you're doing it across your tongue. Now, I've seen all kinds of tongue scrapers out there. The most common one you'll see literally looks like a toothbrush handle with like a little brush thing on the end. And in my opinion, I think those are pretty useless because it barely gets across the surface, where the copper ones, which is kind of this U-shaped metal band, when you rake it across, I mean, you feel that sucker dig in there. And after a few wipes, that brown is gone and you see the pink again. So it is an incredible, oral hygiene device, for mechanically removing these things, out of the mouth. And I mean, if you think about coffee and a frappuccino, like, Mother Nature didn't intend us to have these things. These are all things that humans created over time. All we're trying to do is find ways to combat it.
And it brings us joy. Right.
Yes.
Becca, every day.
I mean, I think God gave me coffee. I do.
Yeah. And I've never told a single patient, they say, oh, I shouldn't drink coffee. It's going to stain my teeth and darken. I'm like, drink that coffee. This is called life. Okay. It is called life. And, we'll help you keep it clean. We'll give you, the tips and the tricks and the tools necessary. I mean, think about it this way. If you went to the dentist one more time per year than you currently do, so your mouth was in a state of perpetual cleanliness, then drink that coffee up, enjoy it.
Is there a time of day that you recommend doing the tongue scraping? Like, is it in the morning, as soon as you wake up, again, after you drink coffee? What do you recommend?
I'm doing it after I drink coffee because I know at that point, the biofilm that's on there, it's just marinating on top of my tongue. It's just, it's taking us good old time to soak in. So that's when when it'll be most effective for removal, is right after you're done. Now, look, oral hygiene is not necessarily the most practical thing for folks. And I'm the first person to admit that, like, everyone's busy, they're on the go and so forth. So, the reality is that if you can't do it right then and there, doing it at any point is better than not doing it. And another little trick is, when it comes to coffee, is at bare minimum, sip some water. Just plain water. Okay, why is that? Because just a simple swishing action will help break up some of the film layer that has not actually, become sediment on your teeth or your gums, on your tongue. And so just simple little things like that.
Can we, while we're on the topic of the main source of my nutrition and coffee, other dietary tips around oral health and dental health, do you have any big ones that you love telling people that you think can be really helpful?
This is the biggest, and actually one of the more newer conversations in dentistry and in oral health. In fact, they did a whole podcast section of it on one of the Huberman podcasts too, where they brought in a scientist, researcher, and it was really incredible information. So, how a minute ago we talked about, like, don't dump lemon into your alkaline water. So the pH of your mouth, which measures the level of acidity. So in a best case scenario, you're neutral. But our diets generally are pretty acidic, right? Because coffee is acidic and sugars, highly acidic. So what happens is the Western diets, which tend to be more acidic in general, will change the pH of the mouth. And the more of an acidic environment you have in your mouth, the higher risk you have for getting cavities. Okay, so I want you to think about this. An acid is something that can essentially burn its way through tooth enamel. And if you are a person, let's use like soda, for example, highly acidic. And so for someone who's sipping on soda all day long, you've changed the pH of the mouth, it's more acidic. You're not only increasing your risk for cavities, but you're also creating chemical erosion on your teeth. Now, your tooth enamel, that's the hard white stuff. That's the shell of your tooth. If you're sipping down Coke or lemon water all day long, the thickness of that tooth enamel, guess what happens? It starts getting thinned out. And your tooth enamel is a protective coat. So the thinner that gets, the more brittle your teeth are, the more yellow they're going to look because the tooth becomes more transparent and the color of the tooth under the enamel is yellow, that's dentin, and they become more temperature sensitive. So when people say, oh, my teeth hurt all the time because sipping on ice water and so forth. And it's a slow occurring process. This doesn't happen overnight. This takes years for it to develop. But the problem is that because it happens so slowly over time, people don't even realize that they're doing it to themselves. Now, here's the real kicker. When I talked about the acidity in the mouth related to cavities, the most common geographic locations for cavities in your mouth are one of two places. Number one, in the grooves, right? You eat something like raisins or something chewy and it gets stuck in the grooves. Well, those grooves, once they have food debris in there, the bacteria go to work. They eat that food as their own food source. The byproduct they secrete is another acid, which then penetrates into the tooth. The second area is in between the teeth where dental floss goes, or where it's supposed to go. In fact, I asked someone this last week. I'm like, when's the last time you flossed? He goes, I don't know, Doc, you were there. So, little dental humor. Okay, so check this out. So now, imagine you have a highly acidic environment in your mouth, and the enamel in between your teeth starts to erode as well. Well, you don't go from no cavity to cavity just like that. It's a slowly penetrating process. And when we look at tooth x-rays, you'll see what's called the beginning of a cavity. It looks almost like a little bite out of the side of an apple, but it hasn't penetrated all the way through. It's more of like a dimple, if you will, like a door ding in your car. Well, what we now know is that the body and teeth have the ability to remineralize the tooth. The tooth was demineralized from the acidity. How do you do that? By changing the pH in your mouth. So if you can decrease the acidity in your mouth, which brings you back towards neutral or basic. And how do you do that? Diet modification. Now what we know is months later, you take new x-rays and that little door ding didn't get any bigger. And in some cases can actually reverse themselves. That's pretty awesome.
So I use Boca toothpaste. That's
hydroxyapatite in it.
Okay, perfect. I was just going to ask, is that something you would recommend? Genetically, people would say, I'd love to hear your thoughts on this, but have softer teeth. But honestly, since I've been using that and doing all of my tongue scraping, and I'm not very good at oil pulling, to be honest, it's more like a texture thing for me. Can do it for a short period of time, but the whole 2-minute thing is not happening. But I haven't had any issues or any further issues. I mean, I honestly didn't have a cleaning that was due. And then the next time I went, they were like, things look great. And I was like, awesome, because I wasn't necessarily keeping up as best as I could have been. So the Boca is what I've been using. So I'd love to hear your thoughts on toothpaste and even some of these other mouthwash and rinses. And I see a lot of the silver products out there as well, like the Elementa silver, if you've ever used those. Do you like those in terms of just daily oral care and brushing?
So the products that I like the best are the ones that actually get used. And I just cannot underscore that enough that, I mean, even if you bought the stuff that's just in the sale bin, the fact that you're putting a mechanical action on your teeth to get rid of stuff that's on it, that's 90% of the battle right there, is just doing it. So, but there are things that will do it more effectively, that will do it better. And so if you won the genetic lottery on your teeth where you just got this rock hard crystalline enamel structure, the maintenance required is a lot different than someone who has softer teeth per se. But we now know that softer teeth have a higher chance of becoming harder teeth if they are being exposed to things like fluoride, and that's a whole nother conversation people like to go down the rabbit hole with, or hydroxyapatite. And basically, these are elements that absorb into the teeth and make it more durable, plain and simple. So based on what you've said, it makes perfect sense because you're basically putting a defensive mechanism. You have the mechanical action, plus you're reinforcing the surface of the tooth to make it more impenetrable to the very things that cause problems to begin with.
Perfect.
So let's dive a little bit into the oral microbiome
Okay.
and the role that it plays to the health of the rest of the body and why it's such a pathway to the rest of the body, because we've had conversations before on our podcast, and I'd love to hear your perspective on things and how you explain it, because I think sometimes just hearing different explanations can
Yeah.
land for people. But why the mouth is like it's the first exposure.
It is the gateway to the body, just plain and simple. And when I was in dental school, which was in the late 90s, the Surgeon General at the time had released the first report linking oral health to systemic health. And I mean, my God, you don't have to be a rocket scientist, a dentist, a researcher to think whatever I stick in here may have an effect elsewhere, right? Because it's a point of consumption. But it's not just, like people think like, oh, all I'm doing is just, I'm putting sustenance in my body. But it's far beyond that, right? Because, you know, your gums, your tongue, they're spots for absorption directly into the bloodstream. Think about this. You ever hear about someone having a heart attack and they stay sticking aspirin under their tongue? Well, why do they do that? Because when it dissolves, it absorbs through the floor of the mouth into the bloodstream, and it's fast. So this has nothing to do with the teeth. This has to do with its ability to go systemically throughout the whole body. Now, one of the things that we also know, well, as a profession, we've kind of known it for a while, but finally, there is becoming a more mainstream awareness about the link between oral health and the systemic health that you have. So I'll give you some examples. The bacteria that you get in your mouth, the plaque and the tartar and the stuff that builds up over time, that has been shown to have links to all kinds of horrible conditions, such as cardiac conditions like having stroke, diabetes, high blood pressure. And they now have compelling data that shows a link between oral bacteria and Alzheimer's. I mean, how crazy is that? They've done research on the brain where they're pulling out bacteria out, and they're like, wait a second, this is oral bacteria. And so if you think about why this is an issue, it comes down to two things. It's diet and longevity. Okay, because we live a lot longer as a species than we did a generation before us, right? Like my generation is supposed to live, 10 to 20 years longer than what my parents were, and the numbers growing, right? So if you think about it, 50 years ago, people didn't live long enough to get Alzheimer's to begin with. Died before that. The problems didn't result because you weren't around long enough. It's the best way I can describe it. And, even related to teeth, people died in their fees, they died before their teeth had enough problems to catch up with them. But now that people are living well into their 70s, there has to be more done to preserve their teeth. And if they didn't take care of their teeth or their oral health, there can be systemic consequences associated with it. So, the low hanging fruit is simply this. If your mouth is in a state of perpetual cleanliness, as opposed to each time you go to the dentist, if you go to the dentist, it's like a whole hammer and chisel project to get all the crud out of the odds of you developing these types of systemic problems over time are massively decreased. Okay? So I think that's a really important point to hit. And, then obviously, the Western diet is generally pretty terrible because it's acidic, it's carb heavy. And these are all things that like to form deposits on the teeth. And if you're not getting it cleaned, now you see how the whole death spiral works.
Yeah. You mentioned something earlier that I'd love for you to elaborate on, and that was biofilms. So a lot of times when we're looking at even, stool tests for some clients and we're seeing certain bacteria, I'm making correlations. Have you had dental work done? Do you have a root canal? A lot of this is looking like it could be associated. And people don't realize that our greatest biofilms come from the oral cavity. So can you just elaborate a little bit on that
Absolutely.
for our listeners?
Yeah, this is a great topic, and I'm glad you're bringing it up for the point of awareness. So, you know, biofilm just simply means think of it as just the stuff that lives in your mouth. That's the easiest way to think of it. And bacteria is native to your mouth. It is supposed to be there. Okay, it's just part of the living flora. And in addition to the bacteria, you also have enzymes in your mouth, and these all live synergistically with one another when you're healthy. The saliva that's in your mouth, and for those who didn't know, saliva actually has two functions. One, it's to bathe and rinse off your teeth to help keep it clean. Number two, is so you don't choke swallowing your food. So it's lubricant, so you can get it down the hatch without any problems. Those are the two main features. But the bacteria that can develop in your mouth that can cause problems, sometimes people don't even know it's there. So there you can now get oral swabbing done in your mouth. And some physicians will do it. Dentist offices can do it. They're, they're easy, and less invasive than a nasal swab, right? And they send it to a dental laboratory or medical laboratory, and they'll test and see what kind of bacteria are in there. And once again, this is nothing that you would ever feel in your mouth, but what we've seen is that a lot of times there can be undiagnosed periodontal disease. And that's a huge one because periodontal disease has a huge relation to the rest of the systemic health in the body. We've had results come back where someone had like a candida infection that they didn't know about. There's all kinds of data that you can get that will tell you about your overall level of health. But more importantly, it tells us about how it can be treated. Okay. And so depending on what the bugs are in your mouth, it could be as benign as you just got to get your teeth cleaned, or you got to get your teeth cleaned more often, or you need to get something called a deep cleaning, which is a specialized type of teeth clean that goes down below the gum line. Or it could be that you need to have antimicrobial therapy and they need to do some type of antibiotic, whether it is, tablets that you're taking for a short course, or there are even antibiotic, they're like these little microchips that can actually be wedged between the tooth and the gum line to soak in and try to have direct contact with where the bugs are to kill them off. So those are some, kind of conventional therapies for it.
And
Excuse
so
me.
for,
And then,
go ahead.
oh, sorry. And then the real cool one too is that technology has improved where there are dental lasers where the wavelength of the laser that's being used, which goes down below the gum line, specifically targets and kills these types of bacteria.
That's really awesome. I'm sure.
Yeah.
I'm excited for those to potentially become more commonplace. I have a feeling they probably will not in the near future, but
Well, they're common, but the problem is that they're expensive.
Yeah.
That's really what it boils down to. And, I think it's one of the things in general, just about healthcare in general, is that, it is expensive. I own up to that. It's expensive to get dental work done. So, but what happens is, as technology gets better over time, the costs of the technology go down, and then you're able to, get a better scale with it. So,
can you give some signs and symptoms for people? So, like, obviously, teeth sensitivity, I think of, and maybe headaches. Like, what are maybe some common ones, and then maybe some not so common ones of something might be going on deeper in the health of the oral microbiome?
You know what the number one thing is that comes into the office, that the telltale sign there's an issue that needs to be addressed? It's the individual's partner or spouse telling me without the other person in the room that they have bad breath. Number one, you would be shocked. And they'll come in and they're literally looking over their shoulder. They know their partner's not even in the room. But that's how sensitive of a conversation it is. They're like, my husband, his breath is terrible. Can you help with this? I can't, I can't say anything. And these are real world problems. They are. So, as the dentist, I have to, gently broach these subjects in a way where someone's not getting offended. But you figure if anyone's going to be able to tell someone, it's going to be me, right? That I wouldn't be doing my job. So that's number one, is that because oftentimes the person that has bad breath is totally oblivious to it. Okay. Why is that? Because bad breath didn't happen from this one cup of coffee that I'm sipping down. It's something that happened, once again, slowly over a longer period of time. And the nose will adjust to what its surrounding environment is, right? I mean, think about someone who works on a horse farm. They don't smell the manure, right? Like they're used to it. So that's number one for sure. Number two is bleeding gums. Okay, now I can't tell you how many times someone will come in and they'll say, my gums are bleeding, so I stopped flossing. Okay, now I want you to think about this. If you were washing your hands in the sink and your hands started bleeding, would you think there's a problem? I think so. So if you're brushing or flossing and you're bleeding, would you just stop it and not do anything about it? Or, just like if your hands are bleeding, like you'd be like, holy crap, I need to call my doctor. But most of the time, the reason why it gets ignored is because it doesn't hurt. And people are pain averse. They might get freaked out with the bleeding, but they just ignore it. So we see this, as dental professionals, whether you're a dentist, dental hygienist, dental assistant, you'll see the swelling in the gums. The color changes, by the way. Normal healthy gums are generally a soft salmon pink color, and the texture is highly indicative of the health. So if you look at like an orange peel, you know how it's smooth, but it's got all those little dimples in it? That's what healthy gums look like. But when gums are swollen and bleeding, they look more like an expanded water balloon, and the color will be more of like a magenta or like an angry red, and very bulbous. And if you just barely touch it with anything, like a dental pick or a floss, and then all of a sudden blood starts oozing out. So here's the crazy thing. The very thing that makes it bleed, which is, some sort of mechanical stimulation or trauma, if you will, is the very thing that helps fix it. So by getting in there and flossing it out, people think like, oh God, I'm messing it up, I better stop. No, what you're doing is you're actually using mechanical action to get the crud out of there, so the gum can actually reduce the swelling because it doesn't have crud stuck in there. And I think that's something that a lot of people just don't understand.
Yeah. And isn't it, I mean, overall, it's a big sign of inflammation, right? Like
100%.
I've always understood. Yeah. I read a book, I was looking it up earlier. It's called The Hidden Epidemic by Dr. Levy. And he was talking all about oral infections causing the most heart attacks and breast cancers. And it was really eye-opening for me to read that book. If you guys,
there was a blood test that they can measure for C-reactive protein, and you've probably heard about that. And it's a measure of what's happening from a cardiovascular standpoint. And these are very simple tests that kind of tell you what's going on. And, the problem, once again, is that someone who's got cardiac issues, the oral bacteria, which can get into the bloodstream in someone who has gum swelling, gum bleeding, a periodontal condition, that bacteria can actually go through the bloodstream and colonize on the heart, and then create something what's called an infective endocarditis, which is nothing you'd ever want to have anything to deal with. So, it's a big deal, 100%.
Yeah. So we run the HSCRP for all of our clients when they're coming in. And of course, we're wanting to keep that below 1. But I'd love to just hear, what do you recommend? So we have our daily oral hygiene, right? And then you should see the dentist a few times a year. I'd just love to know from you, like, this is the ideal scenario for your oral hygiene. And when you would be looking for, like, do you think annually it's a good idea to either have a cone beam scan or do one of those tests that are looking at the bacteria in the oral microbiome, just to know? Like, I think of this as, it's a maintenance, right? Even if I'm not symptomatic, it's something, if I want to optimize for longevity, I want to know there are some of those bugs colonizing, even though I'm not feeling it, to get rid of them. What would you recommend?
So you bring up a really good conversation about, preventive diagnostics and what's appropriate and when. And, as we're understanding now, in the healthcare at large, it used to be like a one size fits all, right? It's like me saying, like come twice a year for a cleaning. It's a blanket statement. It's kind of the law of averages, but none of us are the same. Like the three of us, we're all going to have different requirements of what's going to keep our mouths the cleanest and the healthiest. So, number one, you're going to start with the low hanging fruit, which is your home care. Like there's just no substitute. Diet, obviously, we've talked about that already. Professional teeth cleanings. Most folks will do best at 3 to 4 month intervals. And the reason for that, once again, is because of our diets. Because once that the food debris becomes calcified and stuck on the surfaces of your teeth, brushing and flossing doesn't get it off. It's like, did you ever have that moment of truth where at home you had spaghetti and red sauce on the dinner plate and you're looking at it and about to put it in the sink, and all you got to do is just rinse it off, right? But for some reason, you just decide to put it in the sink and walk away. And then you go back the next morning, and what happened to the sauce? It's all hard and crusty. And you're like, God, I'm an idiot. Why didn't I just rinse that off? It would have taken 2 seconds. That's how the buildup works in the mouth. And so that's why it requires specialized mechanical removal, with a dentist or dental hygienist. You're not able to get that stuff out. So depending on your diet and how good of a job you do cleaning, that's really going to dictate what the intervals are for you. When I say 3 to 4 months, that's just based on what I see with the folks that come through my practice. Now, to get more specific about other types of diagnostics, you asked about bacterial testing and cone beam scanning. Here are my thoughts on that. Number one, bacterial testing. If you're the person, when you go to the dentist's office, you're always getting an A+ report card. You have no what are called periodontal pocket measurements. We should probably touch base on that if you want to. You have no cavity issues. Your gums look really healthy. The teeth look really clean. It's probably not even a relevant test for you because you would have other things showing up that say, hey, you know what, we should probably do this. If you're the person that's getting like, a C report card every time, like a D-, probably not a bad idea. And why is that? Because we know despite your best efforts or lack of efforts and maybe based on how infrequently you're showing up, we're just trying to get chunks of mud off your teeth, but we don't even get to the fine detailing because you're not here often enough for that. And so bacterial testing, I think, is a great idea for us to understand, okay, what's lurking under the hood here. Cone beam testing opens up a whole new conversation. And for those of you listening, it's a CT scan specifically of the jaw and the teeth. And it can show us a lot of important diagnostic information. For someone who's otherwise healthy, it's probably like, going and getting, colonoscopy every 5 years. Most of the time, they aren't going to find anything. But if they do, you're certainly glad that you went and got it. Okay, so the types of problems that you will see on a cone beam scan as opposed to just regular dental x-rays. Endodontic infections, okay? What that means is you have a tooth nerve that's dying. Regular dental x-rays are a 2-dimensional image of a 3-dimensional object. They don't always pick that stuff up. And that's why when people come in with tooth pain and I take an x-ray and I'm like, I don't see anything here, I recommend getting a cone beam scan done because it'll pick it up. But cone beam scans will pick up stuff that is just starting to form, because by the time they show up on 2-dimensional imaging, it's so far advanced at that point that the treatment options are more limited at that point. And the other thing too is that it can also show you if there are cracks in the root structure of the tooth. And that's usually a situation where, you might end up with a root canal or maybe even having to have the tooth pulled and replaced potentially with a dental implant. It's just a higher level of diagnostics. But to be clear for our listeners, what it's not going to show is if you have some specific type of bacteria in your mouth. It won't show you that. What this is doing is it's showing changes in the hard tissue structures in the mouth, which is bone and which is tooth. That was a
So
mouthful.
what are the that's okay. What are the tests that you recommend for, let's say an individual had, I'll use a sibling of mine who's had many
Okay.
root canals. And I'm
Yeah,
like, well, don't you go and have your dentist like check that you don't have an infection? Because from my understanding, with a root canal, like the nerve is dead, you wouldn't necessarily feel anything. So
correct.
in that case, I mean, just from some of the, research and books that I've read, they're saying, hey, I think annually you should be having this evaluated if you have had a root canal or multiple root canals.
Yeah, annually, in my experience, is probably a little more than what's necessary. And I'll tell you why. If a root canal develops a problem, okay, and the types of problems that a root canal that one would typically see would be as follows. Number one, the root canal was done properly, but there was bacterial spread from the original infection that exited out of the tooth into the surrounding bone. When the root canal is done, the whole concept of it is that if the source of the infection is gone, the rest of the bacteria, they can't grow and proliferate, and the body's immune system just wipes out the rest of it, and you're good to go. That's what happens the majority of the time. But sometimes, because the blood supply going through bone into the teeth, in your jaws, it is not a robust circulation system, like your jugular, by contrast. So sometimes the body's immune system reduces the quantity of bacteria where it's basically subclinical presentation, but it's still there. And then months or years later, it multiplies and it grows, and you have a reinfection of the same area. And then it requires treatment again. And sometimes it's surgical intervention in order to treat it. So that's a great example. If you had a cone beam scan, that you could pick up on that. And most of it that we see are what we call ancillary findings. Okay, so pretend I have a patient who comes in and I'm like, yeah, this person needs to get a CT scan because they got pain and we want to see the extent of it. But it's someone who's been on the merry-go-round of dental work because they didn't take care of their teeth over time, and they have root canals or other, things that have been done over time. It's very common, actually, that the scan will pick up problems brewing in those other areas that they were not even aware of because, like you said, they didn't have pain. So it's a great diagnostic tool in that regard. If someone asked me to say, hey, if I don't have pain, like how often should I get one of these scans if I wanted to be a step ahead of it in a preventive manner? And I think that's the question that you're going for. I think, at most, one scan every few years is not an unreasonable recommendation. People have concerns about radiation exposure. And this kind of goes to one of the myths in dentistry about, cumulative effect and all dental x-rays are bad and da, 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 da. And, we have data literally for decades that measures the radiation exposure from a full set of dental x-rays, which is typically about 15 to 20 of those, the little cube thing they stick in your mouth. And they say you actually get more radiation sitting in the hull of an airplane, from LA to Colorado. So when you look at risk and benefit, I think the benefit of having the diagnostics and cone beams certainly spin off more radiation than the regular dental radiograph. So related to cumulative effect, I think doing it once a year is probably simply more than necessary, but not just from avoiding radiation, but because the changes are so slow that I don't think you're going to pick up something necessarily, a year later.
Yeah, that makes sense. Every 2 years, maybe 3 to 5 years or something along those lines.
Yeah.
Can I selfishly switch subjects to the topic of like an Invisalign or, a retainer of nature's?
Mm-hmm.
I do feel like they have the potential for more bacteria and, you're putting the same thing in your mouth every night. I
Mm-hmm.
bought one of those little pods that
Yeah,
cleans
the
them.
dental pod.
Yeah.
Zima Dental, giving them a shout out.
Amazing.
Fantastic product.
I was brushing it prior to that and I change mine every week. So like, it's not that long that I'm in the midst of it or in the thick of it. But the pod, I was like, oh my gosh, this is so much better. So what are the dental pod, the Zima dental pod, is there anything else that do you think it's a good Like,
It's not good. It's freaking fantastic. And they have a new one called the Dental Pod Pro.
okay.
I just got one as a gift. It actually burnt. So my house burned down in January in the fires, and I lost everything. And my dental pod too. And a client of mine just wanted to do something nice, and she came in with a little gift bag. It was a Dental Pod Pro, and I hadn't seen it yet. And so I was so excited to, like have it, because, I just rescanned my teeth in the office to get a new set of retainers made for me. And the cool feature of it is, aside from the normal 2-minute cleaning cycle that it has, it's got this 15-minute mega clean cycle you can do. And so I was like, you know what? I haven't had one of these, and when did she get that for me? So like in March. So basically I redid my retainers early January. I got them a week later. And then, kind of like you, I was just having to do like the manual rinse and scrub, and, they do get, a little gnarly. And it took something that, would have looked like tree bark at that point, like petrified. And I've never seen anything. So it looked more clean than when I got it back from the lab. I mean, that's how good it was.
Yeah. They're amazing. I got my mom because she has the retainers. But so do you think a lot of it comes back to genetics of like how someone's teeth shift, grinding? Because I'm someone that genetically, I've had one cavity in my whole life, and I probably could have taken better care of my teeth. I do a lot better now than I used to, but my sister constantly got them. I never got them. But my teeth, I have a horrible overbite, and I have like shifts that I'm working to fix with the Invisalign. Is a lot of that genetic? Is there anything you can do for it other than just the retainers, keeping them in your life long term, or what? Is there anything else that causes it?
Yeah, it's called life. So everybody's teeth move.
Yeah.
No one is immune from it. What changes is how much movement and over what period of time. And it is different from person to person. Think about this. I'll bet you could remember someone in high school that had braces and they came off and they had the most amazing smile. They didn't wear their retainers, and before they got to college, they were back to snaggletooth again. And then you probably know some people who got their braces off, and they're in their 40s now, and like the shifting is just barely.
You see Liz's smile, and I literally, being on camera so much, I was like, I have to get retainers. I cannot even look at my teeth anymore. Like I was getting like this one was curving in, these were all jagged, and the Invisalign, I'm like halfway through. It has helped a ton. But yeah, I'm always so jealous of Liz's smile.
There's so many factors that will influence the tooth movement. It's like, how crooked were they to begin with? How long did you wear retainers for? Some of it has to do with even how your tongue movement is, because when you swallow, if you do something called a tongue thrust, the tongue will basically position itself forward and push into the back of the teeth. And you swallow a gazillion times a day. So you're putting orthodontic force on the back of the teeth, causes movement on it. So, there's many variables that will affect how much tooth movement one does or does not get. Some people just have more of a propensity to it. My wife, she's had orthodontics 3 times, and, she had them when she was 20 or high school. And then she didn't wear the retainers through college. And then she met me and went into ortho like within 2 months of dating, and got, it was like, it has incredible teeth just in the wrong spot. And then after our first daughter was born, she stopped wearing the retainers. And then at age 40, she went back in a 3rd time. And now she's like, I am never missing a night of retainers again, because no one should have to have braces 4 times in this life. So, I wish there was a better tip for that, and, like a magic cure, but there isn't. I mean, a lot of the work that I do in my practice every day is cosmetic dentistry. So we're talking porcelain veneers. And there's a lot of folks who come in who just wave their hands in the air orthodontically, and I do veneers on their teeth to give them, the appearance of straight teeth, and they still don't wear it. And then, however many years down the road, there's the potential they end up with, crooked veneers, and they have to replace it.
Wow. Yeah. Veneers are not cheap either. I actually didn't know much about the world of veneers until I started talking to a friend, and she's like, I'm trying to decide between a tummy tuck and veneers.
Okay.
They're like, veneers are like what, $15,000, $20,000 in a lot of cases?
I mean, it just depends how many teeth you're doing and who's doing it for you, because what you're really paying for is the experience and the artistry.
Yeah, for sure. And I'm sure, so I have a huge overbite. I always have. And I'm at the point to where like, they basically told me I would need to break my jaw, move it forward, headgear, like, and I'm just like, I'll deal with it. But breathing wise, what do you see? Because I know I've read in terms of,
Yeah,
with,
airway management.
yeah. So with big
Huge,
overbites.
huge conversation in dentistry right now and oral health. So what we now know is that airway is just critical for people to live. And think of air as your gasoline for your engine, right? It's your oxygen. And if and the two intakes for air are your mouth and your nose. If you're mouth breathing, usually it's because there's a nasal obstruction somewhere. So, and it's not uncommon for someone who has a nasal obstruction to also have what we call dental malformations, underbites, excessive overbites, a retruded bottom jaw, a narrow jaw. And so now, if you think about it, if the size of the jaws are deep, the tongue has less real estate to move around in, right? Like it's playing in a small cage instead of a big open park. And the tongue's got nowhere to go except one direction. You know what direction that is? Back. And as the tongue moves back towards the back of the mouth, you're blocking off your airway. So think of it as like a garden hose, and if you kink it partially, like less water goes all the way through. So this is where the whole conversation of sleep apnea comes in. And sleep apnea means you actually stop breathing. Well, for someone who's a mouth breather and their head's back on the pillow and the tongue goes back, when air's still going through, the tongue will actually vibrate against the soft palate and the uvula, and that's what snoring is. But if it goes back far enough and the two kind of stick to one another, guess what? No air goes through. So you have periods where there's no oxygen. And then what will happen is you'll have what are called, apnea episodes where you actually gasp to get that air going and separate the two and create an airway again. So the jaw surgery will reposition the bottom jaw or the top jaw to move it forward and expand it to once again take that small little space and create more space for it. There are also different types of retainers or nighttime guards that are precision molded to your teeth and will take your bottom jaw and pull it forward. Well, when your bottom jaw moves forward, the floor of your mouth is attached to your bottom jaw, and attached to that is your tongue. So when the jaw goes forward, floor of the mouth goes forward, and tongue goes forward, pulling it away from your soft palate, thereby opening up the airway. So it decreases the chances of having sleep apnea. And there are things that you can do to test for it called a sleep study. You can go to a center that does it, or they even have home kits where you just plug these things on you and then go to sleep, and it'll tell you, what your breathing is like at night. So these are, the breathing part to me is huge because a lot of people will say, oh, I'm tired just because I work so hard. And they just don't realize their body's not getting the oxygenation that they need. But did either of you read the book called Breathe by any chance?
I have it. I have not read it, but I have it.
Yeah, it's really good. And it ties in the whole dental component into it and how diet has actually influenced the structure of our jaws and made them smaller, relative to previous generations, and the systemic effects of that on how we breathe and oxygen intake. It's worth a read.
Yeah, I got it. And another friend of mine who's a practitioner was raving about it's a device for children, essentially. My son's not a mouth breather, but they were talking about for kids who are mouth breathers. Like I have a client I'm working with, he's 7 and he continuously gets strep throat. So we had a long conversation about this. I was like, you might want to consider one of these time guards or something to help him. It's something that, many dentists are talking about right now. So I haven't read that book, but I've had it in my shelf for a while. So maybe that'll be my next read after this conversation because breath is powerful.
Yeah.
And we even see, for some individuals, I was at a conference last year and there was a person talking about, I believe he was a dentist. He was talking about for high blood sugar levels in the morning time, check your snoring, check your breathing, check your positioning, because that could be the stress of not breathing correctly, overnight. So quite interesting, but well, this has been great. I think we covered everything that we wanted to talk about. I guess we'll just wrap it up. I'd love to hear from you. If there was one thing you had to shout from the mountaintop for people, like do this every day, maybe it's the tongue scraping with the copper scraper. But I'm just curious, what you would say for all of our listeners to know.
Oh my gosh, that's so hard because there's just like there's so many things that we have to do. That's like saying like, what's the one good thing that you'd have to do for your hair care routine? I mean, it takes a village, right? So okay, here's what I would say. This is what I'm shouting from the mountaintop, and it is not sexy by any stretch of the imagination. If you only got just the one, that's it. I would say get yourself a good electric toothbrush. That's it, because manual toothbrushing, that's like caveman style. It's prehistoric at this point. Do something that can assist you with the mechanical action of removing the debris, the food, the biofilm layers off the teeth. It's not a standalone. You still need to get in between the teeth, with floss or oral irrigation of some kind, be it a water pick or like the Proclaim device. We didn't even get to talk about that. It's an incredible oral irrigator. And I think these are things that that people should consider.
Okay. So we need to consider, well, first of all, I have a question while you just mentioned this. I know we got to go, but my toothbrush has like 8 different settings. I just use the regular one. Is there any benefit to all of the other ones that are like the waves or the pulsing or whatever?
In my humble opinion, no. I think that, it's kind of like, do you use every feature on your iPhone? Probably not. And the point is that they make these things like it used to have 2 features, then it was like 4 and 6. And now like, oh, well, this one must be better as a result. Technology's played such a huge role in improving oral care, and it's becoming more personalized. Maybe I'll throw this in here. You guys can weave it in however you want. So flossing, which everyone talks about, is so dang important, but it's ridiculously hard and cumbersome, right? Because you have to have a high level of manual dexterity. And think about this. You got to spend the same amount of time, the same amount of pressure, getting up in all the crevices for every single tooth in your mouth. And for most people, it's either A, difficult, or B, they just don't want to spend the time to do it. Plain and simple. Okay. So one of the solves for that right now, there's this device called Proclaim. Now, I have to give a disclaimer because they sent me one. I liked it. I actually invested in the company. So I got to put that out there, but I invested in it because I thought it's a really amazing device. So what happens is you go to your dentist and they take a 3D digital scan of your teeth. So this is not an x-ray. These are actually optical camera scans. Then what happens is your teeth get 3D printed and they build a custom mouth guard for the top and bottom that's precision fitted to your teeth. And there's a little handle attached to it. So imagine like a microphone with a guard on the end and you stick it in your mouth. To the end of the handle is a tube and it goes to a canister on your countertop that holds 22 ounces of fluid. You press the button down and you hold it. All the fluid goes through the tube, through the handle, into the guard. The guard that was 3D scanned in your mouth has jet ports in it for the water to come out. And they're aligned to all your crevices. And in 7 seconds, you get 22-ounce mouthwash, whatever you want to put in there. Some people even put like antibacterial liquids in there. And it blasts out all your crevices, the exact shape simultaneously. This has been a game changer because, most people just do the quick up and down and they don't get a lot of the residue and the stuff that's below the gum line. And we have some studies coming out from the company and from some of the research partners and schools and so forth that are showing how some of the oral health problems that we talked about early in the episode, gingivitis and the link between the systemic health and so forth, we're decreasing risk because of this type of personalized care. Toothbrushes are starting to head in that direction as well. So you're going to see more and more of these mouth guard type of brushes, trying to get everything. And it's a really cool time for technology trying to solve. I mean, think about this for a second. Are you telling me that the best solve that dentistry has had for oral health is a piece of string? I mean, like, seriously? Like, we put a person on the moon and that's all we got is a piece of string? So it's really exciting when you think about how technology is going to do a better job helping people maintain. The problem with it is that, generally speaking, like you can't pick one of these up at the supermarket. You got to go and get scanned, and they're an investment piece for sure. There's a price associated with it. But, for those who have the ability to get one, or you think about this, you spend a few $100 on one of these things, but the money you're not spending later because you're protecting your health and you don't need to get ancillary dental procedures that you could have avoided otherwise. The cost savings for that, I think, are immeasurable. And, that kind of ties into, sort of the whole health and wellness thing that's part of your show.
I would do anything not to go to the dentist, to be honest. No offense.
Yeah.
It's not my favorite time. I'm like scarred for life. I had headgear and the whole 9 yards when I was young. So yes, I still have teeth. But speaking of the device, I definitely want to look that up. Can you tell us again so that we can have everyone write that down?
Yeah, absolutely. It's proclaimhealth.com, and Proclaim is PROCLAIM.
Okay.
HEA.
Yeah.
Can you also
in the meantime, water picking would be something that you would recommend over flossing. We've had other dentists say that they would prefer a water pick over flossing.
So the idea is that you're hydro washing the stuff off. And what floss does best that a water pick is not able to do is mechanically removing a chunk that's wedged in between your teeth. Like, you ever got like popcorn jam between two and you're like, a water pick isn't getting that out. So you got to have something that can go up in and fish it out. So floss is never going away, but like there's less of that compared to the buildup and the crud that gets wedged in there that hydro washing it out is very effective with.
Okay, cool. My last question, and I know Becca had one more, is what's your favorite electric toothbrush then? Since you mentioned that earlier, do you have one?
Yes, I do. I love the Suri toothbrush, SURI. And and I'll tell you why I love it. Okay, number one, you get an absolutely fantastic clean, meaning that its efficacy is phenomenal. Number two, it looks great and the battery life is fantastic. Like, how have you ever packed and put your electric in there and you're like, shoot, I don't know if it's going to make it, like, is it going to make it a week? I don't know. And Suri's is 40 days. So that's pretty awesome.
Okay.
And the third thing, which is really awesome, is everything that is made out of is sustainable.
Okay, cool.
Yeah.
Are you affiliated with them? Do you have a code for them or anything?
I don't know. I just, I got to use the product, and it's a brand that I would love to become involved with. And, usually I only talk about stuff that I have personal experience with, or I think that it's something that people should consider. So I wish I did.
Yeah.
Okay. Sorry, Becca, you go.
You're fine. I was curious on the device the bottom retainer that helps pull the jaw a little bit forward, or that helps the tongue surface area in the mouth.
Okay, so you're probably talking about, without having a specific name, my assumption is you're talking about some type of jaw expander or orthodontic appliance. And the one for the lower jaw, so the way that these things work is they have to be used while you're still growing. So for adults, you're kind of out of luck at that point. You have to have surgical intervention to where bolts are used, and it's a thing. But for kids that are growing, like both my daughters, had smaller lower jaws, and they were able to have types of orthodontic retainers that actually stimulated movement and growth of the lower jaw to get it to catch up to the lower jaw, where neither of them needed to have anything more than that. And, to which I'm very thankful for that. My girls didn't ever require, the need for a surgery.
Yeah. My son's a total mouth breather.
Mm-hmm.
And we did the whole tonsils thing, and he had horrible croup multiple times when he was younger. And so we were like, it's tonsils. And it's definitely not. He still is a mouth breather. So I'm considering, is it, because I have a horrible overbite, and like I said, I will put off that surgery for probably the rest of my life if I can. But for him, I'm considering that might be a possibility. So I will definitely look into that. And I'm assuming.
Yeah. I mean, how old is your son right now?
6.
Yeah. So, the idea is that you want to have an orthodontist that also has expertise in craniofacial biology. And what that does, that's someone who has, additional training on the formation of the jaws, because if they can nudge it along as much as possible, The best case scenario is he never ends up needing anything. But the worst case scenario is, yeah, he needs a surgery, but it's a small surgery as opposed to large surgery because the movement required is so much less because they were able to stimulate as much growth as possible along the way.
Got it. Okay. Well, I will live with mouth tape now, and I even bought some nasal strips to wear at night. Crazy.
Breathing strips are fantastic.
Yeah. So I did it last night for the first time because I sleep fine. Like, that's not my issue. But I did mouth tape and a nasal strip last night and took a niacin before bed. My average heart rate overnight dropped by 8 points.
Wow.
Crazy. So that I know that I'm probably recovering better, and I'm going to keep up with that. Much to, I'm sure, my husband's dismay. He was not home last night; he was traveling. So tonight, when he gets home, I'm sure he's going to love that whole get up. This has been amazing. Thank you so much for taking the time and sharing your expertise and knowledge. And I think that there are going to be a lot of actionable things in here that our listeners will be able to act on.
I hope so. I'm not the scientist behind all this stuff. I'm a bit more of a practicalist when it comes to it. And I try to explain it in a manner that it's easy for folks to digest. So I hope it resonates with your audience.
Yeah. This has been great. Thank you so much.